with you tonight. I'm also representing the Clarkson Early Learning Task Force, which was appointed by the city of Clarkson not too long ago to begin to look at early learning and literacy needs and plans for the Clarkson community through the lens of equity. And so we're really excited to be a co-sponsor of this workshop this evening. As Awat mentioned, this is the continuation. We hope it will be a conversation. And we started this whole work because we began to realize, as we were meeting with the task force, that we didn't know very much about young children and COVID-19. And we knew that there were others out there that may have the same feeling. So we reached out to our colleagues at Georgia State University and the Prevention Resource Center and said, what if we got together and did a webinar and we asked pediatricians and others in the know to really give us what they knew about young children and COVID-19 and what we still don't know. And then we also wanted to know what our child care partners were doing in the wake of this pandemic. And very importantly, we wanted to know what families were experiencing, feeling, thinking about, and wanting to know. And so we invited some of our colleagues who work directly with families to join us this evening. So it gives me a lot of pleasure to introduce a new friend and a new colleague, Ashli Owen-Smith, who has done so much to put together the content for the webinar tonight. So Ashli, take it away.
Thank you, Roberta. It's great to be here with all of you, and thank you for the opportunity. As Roberta mentioned, she and I have been working on these webinars and hope they'll be useful. I am an assistant professor in the GSU School of Public Health and working with the Prevention Research Center at Georgia State that's focused on addressing social determinants of health in Clarkston. So we hope that this will be one of many activities for the community. Next slide. So our agenda for today's webinar, the first panelist we have is Dr. Lori Bowden, who's a pediatrician with Ethne Health. Some of you may be familiar with that wonderful clinic in our Clarkston community. And what we're gonna do is present and discuss a flip book, a resource document that we put together to distribute to the community specifically about children and COVID-19. So I'm going to show all of you that flip book and we'll walk through it together with Dr. Bowden so that she can provide additional commentary, additional content as needed. Our second panelist is Nadia, who's a parent educator for New American Pathways. And Roberta will be facilitating that conversation with Nadia, specifically talking about what families are asking and what they are experiencing. And our third panelists are Alexandra and David, and Roberta will also be moderating that conversation. They are with the Giselle Learning Academy and are going to talk about experiences from a child care center's perspective, what they've been doing, their plans, how they're handling COVID, and dealing with all of the often overwhelming expectations and recommendations around childcare. And then we will hopefully have time for some participant conversation. We want this to be as interactive as possible. So Roberta and I will hopefully be able to save some time for that and facilitate. As Awet mentioned, feel free to enter any questions or comments in the chat as well. Okay, so as I mentioned, I'm going to show everyone this resource book that Roberta and I developed in collaboration with folks from the Georgia State University Prevention Research Center and CDF Action, as well as the Adult Learning Literacy Research Center. And what I'd like to do is walk through each page, present the content, and then provide Dr. Bowden with an opportunity to add any information that she thinks is important. So again, if you have any questions or comments as we go through the resource, please feel free to jot it down or ask it later or write it in the chat box. So one of the first questions, certainly that we have heard quite a bit about is, what is the chance that my child or a child that I care for will get sick with COVID-19? Certainly it's important to emphasize that children can get the virus, and that they can give the virus to adults, and adults can give the virus to children. However, our research is suggesting that children represent a smaller share of cases, which is indicating that they may be less likely to get COVID-19 compared to older people. Dr. Bowden, I was hoping that you could comment a little bit on the new Centers for Disease Control report that just came out about COVID among children. I know we're learning more and more every day about COVID specifically with little ones, so under the age of 5. Did you have anything you wanted to add to our understanding about COVID and the risk of illness among little ones?
Yes, I think it definitely has, there's been a lot of research, a lot of different things coming out about young children with COVID. And most recently, I know there was the South Korean study that showed that the young children, they may not actually spread it as much as in the up to age 10-year-old group, but the 10 to 19-year-old group could spread COVID as much as adults do. There's also the study about the possibility that the young children may
Did we lose Dr. Bowden?
spread to others, because we've seen so often that children are not the first case in their home to get COVID-19. They usually get it from an adult or an older person in their household.
Great, thank you. That's helpful to understand. Next slide, please, Linda. So another question that we've heard a lot about is related to concerns about children who have other health problems. And, are these children at higher risk for COVID compared to children without other health problems? So we don't know yet if children with other health problems have a bigger chance of getting sick with COVID. I've seen some data that suggests that the children who have more serious illness and have been hospitalized, and the very small number who've died, are oftentimes have been children with other health problems. But we have a lot left to learn about this. So Dr. Bowden, could you weigh in here about any important considerations for families or other people who are taking care of children who do have other health conditions or have special needs? Are there things that those families or care providers need to be thinking about?
Yes, so in the Children's Healthcare of Atlanta, the admissions there throughout this year, they have noted that the number of children who have been admitted there, that they do tend to have an underlying condition such as asthma or obesity, sickle cell anemia, or cancer. So especially the kids with asthma, as we are, especially those with asthma really should be checking in with their doctors to make sure that they're under good control, especially as we get into the fall with the flu season coming. It's going to be really important for them to be very well under control. And then obviously the children such as the ones that have been admitted to CHOA that have sickle cell disease and obviously cancer, children with obesity, really to do what they can to optimize their health.
Thank you. Next slide. So overall, our data seem to suggest that the majority of cases are mild or even asymptomatic, and that a smaller numbers, so I've seen statistics about 15% have severe infection requiring oxygen, for example, and 5% are critical, which may require ventilation, for example. Some reports that have come out recently have suggested that potentially as many as 40% of cases are people who are asymptomatic. However, those individuals can still spread the virus. And in fact, some data suggests that, in fact, people can be most infectious the day before they develop active symptoms. So this is, I think, an important point for us to all understand is that we can't know whether someone has COVID-19 if there are no symptoms present, because there are a significant number of people who do have the virus but are asymptomatic, meaning they are not showing any symptoms of the virus. And that's why our recommendations here are that it is important to wear a face covering and stay 6 feet apart from people when you're leaving your house. Next slide. So this is a question that has come up a lot, both in my personal and professional interactions. What to do if someone in your home or in your immediate community has symptoms. And so we have some recommendations here about making sure that if you're caring for a child, to have someone else care for the child if you're sick. And if that's not possible, everyone should be wearing face coverings, washing hands frequently, and keeping the house clean as possible. And then monitoring children for symptoms that could emerge, and certainly calling the doctor if you or a child that you're caring for is sick. So Dr. Bowden, in light of all of these recommendations, I'm wondering if you might have any other recommendations in terms of what families should do if someone in the home has symptoms or is sick. I know, as a side note, some people that I've spoken with are really nervous about going to the doctor because they feel like it might expose them to COVID or other things, or really worried about going to the emergency room. So what would you advise families and caregivers of children to do in this situation?
So if a child is sick, especially if they know someone else in their household already has COVID-19, it probably is not necessary for them to get tested. So they would not really have to go to the doctor unless they are having more severe symptoms and shortness of breath and persistent cough, those things. And I did want to highlight on this slide that the kids, they could just have something as simple as a stuffy or a runny nose, which is so common in kids, but that could be the only sign of them having COVID-19. And then just from the doctor's standpoint, we are working to keep our offices clean and to keep well and sick children separate, and well and sick patients separate. And so we definitely encourage children to get their immunizations and to get their checkups as they need to for school. But you've outlined it real well on that page, the things that are most important.
Yeah, it's interesting that, interesting is probably not the right word, but it's frustrating probably for many families that the symptoms of COVID, especially in little ones, their symptoms are so similar to other conditions that kids get all the time. I mean, I have a toddler in daycare, and when he was in daycare, he's not now, it was not uncommon that he had a runny nose or a cough or sneezes and even a fever now and again. And it's just hard for families to judge when it's just a cold and when it's something more serious.
Right, exactly. And it may end up completely being like just a cold in a child, but just being aware that, you know, if someone else in the household has COVID-19 and the child develops any of those cold symptoms, they probably have it as well.
Thank you. Okay, next slide. Okay, so wearing a face mask or face covering, should children wear them? So the recommendations are that if your child is 2 years of age or older, he or she should wear a face mask in public, just like families and just like parents or other adults are doing. It's important to highlight that children under the age of 2 should not wear a face mask, as well as children who may have difficulty removing the mask. So children who have other disabilities, for example. So that's just an important caveat. And that masks should be worn in public spaces where your child is likely to come within 6 feet of another person. So grocery stores, any other kind of more crowded places. If you're at home or you're somewhere where you can stay 6 feet apart from other people. So you're in a kind of open park area or going for a hike and other people are not around. You do not need to wear a face mask if you can maintain that distance. So, you know, Dr. Bowden, I know this came up a little bit on our previous webinar, and Dr. Arenas helped us understand this a little bit. I wonder if we could revisit this topic of how we can get children to wear a face mask. I know many of us who are parents of little ones are very challenged by trying to get little ones to keep it on. So I wonder if you could share any suggestions or tips with us.
Yeah, I think what the ideas she shared the last time about getting the cool masks that have all the cool action heroes or the princesses or whatever they have on them that will make the child be more likely to wear it. And make sure it's a good mask. One thing that I see all the time is people messing with the outside of their mask, and that can introduce infection to you. So this is for adults and children. Not get a good mask that fits around your nose well and fits around your ears well, so that you're not having to pull it up and move it around all day long. And then for the children, you know, putting masks on their stuffed animals and on their dolls and those kind of things. Drawing pictures with masks on the pictures you draw may help the child to see it as a more normal thing. And then for the adults to wear a mask some around the home so that the child can see this is normal, it's not scary, it's part of what we do these days. So
yeah. I know anecdotally we've heard a few stories about children in childcare centers admiring cool masks of another child and then wanting to share and like trade masks. So certainly that's another potential problem in terms of you know, being counterproductive.
yes.
Okay, next slide, Linda. Okay, so this issue about can family and relatives, loved ones hug and kiss my child? This is a really hard time when many of us are feeling very socially isolated and want family time and affection. So this is a really challenging thing. And you know, the recommendations are that, you know, if families or relatives you know, aren't living in the home, the child should maintain that social distancing 6 feet away. And if you do have people who are going to be coming into contact with you or your child, again, wearing a face mask, washing hands, or using hand sanitizer before touching your child. And, you know, I think a related question that has come up that I wanted you to weigh in on, Dr. Bowden, was this issue about whether grandparents and other relatives can come visit. So kind of similar question. You know, how can families kind of manage this social isolation, wanting their children to still see grandparents and other important family members during this time, not keeping them separated for however many more months this is going to go on? Do you have any other thoughts or recommendations about how families and other people who care for children can negotiate this tough situation?
The only other thing I would add to what you have on the slide is possibly to meet outside, where it's less likely, where the germs will be more likely to be blown away, but still wear masks. But it's difficult, and the recommendations on the slide are good. So.
No, meeting outside is a great addition. Certainly much safer. Thank you. Okay, next slide. So this is a question that I continue to struggle with personally with childcare for my child. Is it safe? You know, and there's really, unfortunately, no clear answer to this question. It depends on so many things. Some of us need childcare so that we can go to work. Some of us don't have people at home to watch our child. And so this is a decision that each family needs to make and weigh the benefits and risks given their circumstances. So Dr. Bowden, I'm just wondering if you might comment on this decision process for families, some of the things that people may want to consider when they're weighing the benefits and risks of this really difficult decision.
Yes, I think just seeing what things that the daycare centers have in place for keeping all the surfaces clean and keeping everything clean, what they have in place for keeping children separate from each other, and how big are the groups of children that are together, and having those screenings, having multiple ways of screening by the questionnaires at the beginning of the day, and also just keeping the cleanliness of the center itself can be some helpful things. But I understand it's tough trying to navigate that. And I feel like a lot of these learning centers are doing a good job with trying to keep their facilities as safe as they can for the kids.
We'll revisit this conversation later in our subsequent panelists from Giselle, who can talk a little bit about what they're doing to keep children safe. And I know they're doing a lot, so we can continue that conversation in a minute. Okay, next slide. Okay, so, can my children go outside? Can they play with other children who live in my apartment complex or in my neighborhood? Again, the recommendations are to avoid other children who are outside of your home. If children are playing together, trying to maintain that 6 feet social distance, really not having play dates with children from other homes, as hard as that is right now. If you do have those kinds of interactions, again, going back to Dr. Bowden's point earlier about family members, having gatherings outdoors is a less risky decision. Again, wearing face masks if children are over the age of 2, making sure they're not sharing face masks with one another, and then again, good hand hygiene. Dr. Bowden, we had a little bit of a conversation in our first webinar about swimming pools that came up. And so I'm just wondering about, what are some other activities that families and people who are taking care of children might consider? Can families and caregivers take children to the park? Can they go to the swimming pool? Any thoughts about, how, as families and people who take care of children, how we can engage children, keep them active while also keeping them safe? It's hard.
Yes. I think parks, at least where they can be outside and run and just, a lot of the parks may still be closed as far as swing sets and climbing things, which they don't get cleaned anyway. So, but being able to run around and there are plenty of neighborhoods where children are walking around with their parents. So many neighborhoods have gotten very creative and had scavenger hunts and things like that to help keep kids engaged and to keep them interested in being outside. Learning new skills, you know, how to kick a ball, how to play soccer, how to play baseball, how to ride your bike, you know, all those things are good for the kids to be outside, and having nature hunts, so many things. And the CDC originally, I think, has said that the pools are safe, that that you do not spread necessarily COVID-19 through pools, but I personally don't quite understand how that can be, because viruses like adenovirus spread through pools. But anyway, I personally would probably not be real thrilled about lots of children being at pools all the time. But I think there are plenty of other ways to get active and get outside and be outside your home or where you live.
Have to be creative.
Yes.
Yeah. Okay, next slide. Okay, so questions about public transportation. Generally, again, it's not ideal to take children on public buses, trains, taxis. Certainly, many of us, because of childcare constraints and work demands, may need to do this. And so again, wearing face masks, trying to social distance, using hand sanitizer, trying not to touch surfaces, keeping your hands away from your face, avoiding touching your face, and again, face masks. And I think a related question that's come up several times is about traveling. I think the summer is winding down now, and kids are kind of going back to school in a hybrid or remote learning models. But families, I know, are wondering about whether they can travel right now. So I don't know if you have any comment about that, and how that may or may not be different from these other recommendations with respect to public transportation.
Travel is, for the most part, not encouraged with children, but it might be possible to take a day trip where you're going to a park to go hike or go do something that's outside. There again, outside is key.
Mm-hmm.
So if it, it could be the beach and be outside, but there is more risk the more you travel.
Okay, just have a few more minutes. Linda, next slide and we'll wrap up. So Dr. Bowden, you alluded to this earlier, and I think it certainly bears repeating. Questions about, should I continue to take my child or children that I care for well child visits? And Susan, you addressed this in our first webinar. And the recommendations, as I understand them, are that absolutely it is critical that children stay on their immunization schedule, and that they can wear a face mask if they're 2 or older, trying to social distance when you go to the doctor. And you mentioned that most doctors' offices are separating sick children from well children. So I know many clinics are doing a really good job at making sure that children are safe when they come in for well child visits. So are there any other important factors that you want to mention with respect to routine well child visits in this context?
I do emphasize getting the immunizations, because if a young child under age 2 does not get their immunizations, if they get COVID or if they get flu, they might not be immunized against some of the bacteria that can cause more problems on top of COVID-19 or the flu. So that is very important. And also just to emphasize the importance of children, especially this year, getting their flu vaccine, because it's going to be difficult to navigate COVID-19 with the flu this year.
Yeah, that's a great point. Okay, and then I think our last slide is about children getting tested for COVID. This has come up a lot in some of my both personal and professional conversations. If you feel like your child has symptoms of COVID, should you take your child to get tested? So Dr. Bowden, any thoughts about what might be some factors to consider when making that decision?
Yes, so really, as I stated before, they don't really need to get tested, especially if they know that someone else in their household has a confirmed case of COVID-19. In some situations where where some of the kids who are going to in-person school, they may need, or even the daycare in the preschool age group, they may need to be tested to know whether they can go back to the school, or at what point they would need to go back to the school or to the daycare. And really in the younger age group, I mean, those would be the main things I can think of. Even if it's somebody with an underlying condition, if they get sicker, then they will definitely be tested. So those would be my main recommendations with that. But overall, they would not have to be tested.
Okay, that's helpful. Thank you. Lyndon, the next slide, I want to pause on this slide for just a minute, and then I'm going to turn it over to Roberta. All right, next slide, Linda. Okay, well, we'll pause on this slide while maybe Linda stepped away. What I was planning on doing was having a brief opportunity for folks to provide any feedback that they have about the flip book. But I think what we need to do at this point is go ahead and turn things over to Roberta, who is going to have a conversation with Nadia from New American Pathways. And then if we have time at the end, we will come back to an additional discussion about the content we've covered thus far. So I'll turn it over to you, Roberta.
Okay. I just want to echo that we definitely want to take time at the very end to get your feedback on the flip book, which I think is really exciting, and to see how we might make it even better and how we might disseminate it. So welcome, Nadia. We're really glad that you are here with us tonight. And wanted to say that really glad that you've taken the time to do this. And we'd like to ask you first to tell us a little bit about yourself.
Sure. Hey everyone, my name is Nadia Wangachuchu. I am a parent educator. I work with New American Pathways, a refugee resettlement agency. I am been working with them for 5 years now, serving refugee families. I am also a student in a nursing program at Georgia State, and also a very proudly mother of 3 myself. Thank you.
So thank you very much for sharing that. We think it's really important as we learn about what we know about COVID-19 and what we don't know, to also hear from parents and the parent voices. So you do both. You actually work with parents and you are a parent.
Yes.
So we're going to ask you some questions about the parent's point of view. So tell us a little bit about what you do as a parent educator with parents as teachers. What is that, and what is home visiting, and how do you get to know your parents?
So I think I'll just talk about the program overall itself. Parents as Teacher is a program that builds a strong community by thriving family that are healthy and safe and ready to learn, by matching them with trained professionals who will do regular home visit in the earliest life of a child, from prenatal to kindergarten, so that all children can be able to learn, growth, and also realize their full potential. So that's basically what I do. Just that's the overall of the program and what they do. But what we usually focus on is what we call parent-child interaction, which is more of creating learning activities where we bring within a home with the parents and also be able to cover up what we call developmental central parenting, which also covers the attachment of a mother, discipline and nutrition, safety and transition. And least not last, also covers the well-being of the family, where we have to actually know the well-being of the cover the educational, the employment, basic needs of the family, how to connect them to the resources they actually need. And that's basically much of what parents as teachers do.
So you really go visit them in their homes, which you did before the pandemic.
Yes.
And there are several home visiting programs that serve Clarkson residents. A lot of people don't know about them because they don't see you. You're mainly in people's homes.
We are always on the field.
Parents and sort of role modeling different activities with them and helping them do some screening as well.
Yes.
We are pretty excited. There's going to be a new home visiting program coming pretty soon that maybe we'll do another webinar on, called Safe Care.
Oh, great. That's great to hear.
Right. But of course, now you're not visiting families because of COVID-19. How are you connecting with them, and how are you sharing information with them about the virus?
The way we connect, we use technology, because of course everyone is doing virtual learning these days. We use what we call WebEx, where we would be able to see the families and share the information, share the resources that is in and around question they have, especially about childcare, schools, and everything around how to reach out for any resources they need for, like housing and how to give in food pantries and stuff like that. So we usually will use WebEx to connect with them. And also for those who are not able to use this technology, we keep doing the home visit on the phone. And this is 24-hour phone open line, because we know, as you know, all the mothers are going through chaotic right now, that they are getting ready for schools, the childcare, all those questions they have. So we have to make sure that our parents are safe, our parents are ready, and they are aware of what is actually going on, and I'll be able to answer their questions. So we're still doing our regular home visits and be able to answer the questions.
In a new way, in a new normal, as we say, right?
Yeah, in a normal way, and then actually it is actually became so more sufficient than just anything, just because there's questions all over, and the parents are the ones have them, and you want to be able to actually answer them. So you have to be able to still be in touch with them. So
you have to be very knowledgeable about COVID-19.
Yes, we
so
correctly.
Will also help, and the booklet will help also. So how are families dealing with physical distancing, wearing masks, using hand sanitizer, trying to keep people?
So just to make sure that our parents understand and know what it is. Most of them, they don't really understand about social distancing, and but every home visit that we do, we make sure that we touch base on everything about COVID-19, especially
How are they doing? How are they doing? What are families telling you?
They ask more about the family asking. What they're asking about is more of how safe are our children going to be in childcare? How can we make sure that other people are providing childcare to us are being safe to our children, especially, in our refugee community, that a family tends to share childcare. It depends with schedules they switch around. So, but they do scare of those things. They don't understand that how I may be safe, but my neighbor who's watching my child may not be safe. How can I keep my child safe? How can I make sure when my child is safe? How am I making sure that these early learning are actually cleaning and keeping the children the 6 feet that they're talking about? So this is actually a question that we do ask the early learning to help us with. You have to call them and be informative of what they actually providing, encourage the mothers to attend the house opening houses, because that's where they talk about the overall of what they're doing, so they can be actually feeling safe for themselves. So that's the most question. And then all those questions also you ask that you put here on the slide before. Yes, they do ask if it's okay for my child to be vaccinated. Is it safe to take them to the hospital? How safe are they in a hospital also? Things like that. Maybe I may go to the pediatrician. By the time I come back, I did carry COVID-19. Then I pass it out to my child. So how do I know it's safe enough? So we do have what we call group connections within WebEx, where we actually have to ask those questions to providers, and then let us know how they're doing. Majority of social distancing, and how can I usually let the kids come, or the parents also, can they get their yearly checkup? Can I, when I feel sick, can I go to the doctor? Those are the questions they ask every single day, that we do have to make sure we repeat and assure them that the hospital is safe. Just like the doctor just told us, Dr. Ren just told us in a minute ago, the slide that you just showed, those questions comes every single day. Then we have to
How are the families doing? How are they coping? Are any folks losing their jobs? Are they in need of anything? Are you seeing any increase in mental health issues? How are our families doing?
Our families are doing actually pretty well than actually, they're doing pretty well than I thought, actually. But when all this started was when things were really worse, when parents was worrying about going to work, when they already know that within the workplace there was someone who actually had the symptoms of COVID-19. Yes, they really had some families who lost their job because they had to stay at home, giving childcare to their kids who actually out of school right now, which is going to be actually a bigger issue now, that all the kids are home doing a virtual classes. And then you remember that some early kids, some underage kids, especially pre-K students, also will be at home doing virtually classes. This is going to be a lot of parents who are actually going to be out of work than what it is right now, because they're providing childcare. I'm not able to afford my child to be out there. Actually, you still have to be at home if they're going to be virtual classes. For the younger one, especially the kindergartners, the first graders, they still need their mother attention. Yes, they are losing their job because there's no other way. As you know, that's when the resources kicks in around your community, what's out there, how can they help them with the housing and any other thing that's out there. Yes, they are coping well, but when it gets to jobs is where things are really not going so well.
So that is really true around the country. I read several articles recently where a lot of women of all economic stages and ages are making a decision to stay home and quit their jobs.
Do you really? Even us as working moms, it's really hard for us to even imagine. I have 3 on my own. They have to do virtual classes in the morning. I'm at home working. Can you imagine? Imagine I am even lucky enough to be at home working. So can you imagine what our families, other families that we work with that are not able to be at home to do this, how hard this can be for them. We don't have answers yet. I wish someone can give us answers to that, but it is not. We're waiting for Robert. You know, you always give us those juicy resources around the community. So we are waiting to see what comes out of this and what help will be there. But yeah.
That really was my last question. What kinds of supports do you think the community can provide to families? What would you like to see more of in order to support some of the families you work with?
If there were any help with, I can't say childcare, this would be like providing help for families with working moms, single moms who are not able to afford anyone to watch their kids. What help can, the help you can give us is open centers that can allow those pre-K, those kindergarten, second graders to attend and be able to do their virtual classes. That's the help we are looking for. I know it's a really hard thing to ask right now, but that's the help they need. They want to see centers open to help them, help the kids who are virtually at home. So I don't know, but if you get one, please help us. I will be #1 to provide all the referrals you need.
Well, I know that you are out there because I've come to you for resources. And I know that you share a lot with your families, and we want to continue to support you in your work and working with families. So this is really a great segue into talking to our next panelists, and we'll get back with you in a few minutes to ask you some additional questions. But
Thank you for giving me a minute to talk.
That was great. So our next panelists are actually going to talk to us a little bit about childcare and what they are doing to keep children safe and what their childcare program looks like. And it gives me really great pleasure to introduce again some fairly new friends, Alexandra and David Cesar, who are directors of the Giselle Learning Academy, which is located on Memorial College Avenue. I always want to say Drive, so they taught me to say Avenue, not Drive. And it's a center that I've gotten to know recently that is really been involved in working with families, not only in the center, but also in the community. So Alexandra and David, we're delighted you are here. And we'd like to ask you to tell us a little bit about Giselle Learning Academy. How did you get started, and how many children you serve, and a little bit about your philosophy.
Well, good evening, everyone. Good evening, Roberta. Thank you so much for having us tonight. I am so delighted to be amongst you all tonight. I am the owner-director of Giselle Learning Academy, located at 3900 Memorial College Avenue, Clarkston, Georgia. Our mission at Giselle is we are dedicated to making a difference in people by helping them learn, grow, and thrive in the community. Our philosophy is based on family involvement, flexibility, excellence, respect, and integrity. We started back in 2013 with an after-school program. It quickly grew into a full-blown nursery, and we moved into the Clarkson location.
And how many children do you serve?
Right now, we are licensed for about 117 children. So we're quite small, and our rooms are quite small, which is very helpful.
So you think that really helps in the ratios and keeping the class size small in terms of preparing for COVID-19?
I think it does help. I did not speak out of program, the different programs that we have. So the program that we have a nursery for infants from 6 weeks to 14 months old. We have a toddler program, 1 and 2s. We have a preschool program. We have a pre-K program, and we have a lottery program that's partnered with Head Start. And we also have an after-school program. So each of these rooms are small in a sense. The only room that we have that's a bit larger is the Lottery 2 pre-K program.
Okay. Who are the families that you serve?
Currently, it depends on the program. For instance, the Lottery Head Start blended program, 90% of our population come from the refugee population. Throughout the center, we have quite a large number of refugee families. But the after school program, we have a lot of DFACS children, children that come from foster care homes. And we also partners with the neighborhood shelters.
What about Head Start? Tell us a little bit about your Head Start program.
The Head Start program is income-based. The children are able to apply, and we only hold 4- and 5-year-old slots. Now, if you have a child that's 3 or younger, because we partner with Head Start, we are assigned a family advocate. She will take the application. If we don't have a slot for Head Start for that age group, they will place the child elsewhere nearby.
So one of the things you do is help families find childcare if you can't serve them at the moment. Tell us a little bit about your your fee structure and your sliding scale, what income families. And if somebody comes and doesn't have a whole lot of money, as we're hearing from Nadia, who, how do you work with families who may not be able to afford a whole lot for childcare?
Currently, I want to say about possibly 95% of our families don't have a copay. So we take several grant system, and we also take scholarship, we take the CAPS. And when the families come, we gather all the documents on their behalf, and we apply all kind of funding that we can so they don't have any payment.
So you have several people that are there at very reduced fee or sometimes no fee because of Head Start and other scholarships. That
Most families, I want to say maybe 5% have a small fee, but most of them, they don't have a fee.
So that will help Nadia and her families who are looking for childcare that is reasonable or even free. Tell us a little bit about the quality of your program. Do you have any, are you licensed, are you quality rated? Tell us a little bit about how you are viewed by the public.
At this time, we rose from 1-star program to a 3-star program recently.
And what does that mean?
With 3-star quality program, it means it's the highest rating from early learning department in Georgia. And it took us about 5 years to get it. And we also have a licensed preschool, which is licensed through GAC.
And so your teachers, do they have degrees? Do they have training? What kind of professional development do you do?
The teachers are required to have a minimum of a CDA. However, we have teachers with master's degrees, and we have teachers with teaching license. They have a bachelor in early childhood education, and they also have a teaching license. And we have a couple of them right now. Due to COVID, the state waived the CDA fee, and they got into the program. They're on their way to getting their CDA.
So you really people to get professional development.
Yes, it's a requirement.
So what languages are spoken at your center? Do you have teachers that speak different languages, and do you have families that speak different languages?
Yes, we do. We are a multi-diverse center. Our student body shows it, and our staff also shows it. So we do need translators, and it's really convenient to have them in-house. We have teachers from all over. They reflect the students that we have at the center. And sometimes some of them are parents that we hire.
We have a really diverse staff as well.
Yes.
What safeguards, we've talked a lot about COVID-19 tonight, right? I've talked to you a little bit about your program, but what safeguards are you making sure are taking place in your center, the Georgia decal standards?
Okay, I'm going to allow David to take that part.
Okay.
For the safeguard, but I just wanted to say we remained open throughout the pandemic. We did a survey, and the parents that we serve, they're blue collar parents, and they work in the food industry, they work in transportation industry, and they could not telework. And for this moment, we only serve essential workers. So the parents that are not do not have to work, we ask them if they could please stay home.
So you're really
the
workers of important workers.
Yes.
Essential workers.
And single home moms, parents that only have one income coming in, and it would have been detrimental.
Yeah, before we turn to David, and we only have about a minute or two more, but do you have any openings? So if Nadia has a family that wants to enter your center, do you have any openings right now? I know you've been open throughout the pandemic, and
yes,
in some areas.
We have been open throughout the pandemic for our population that was already enrolled. However, Lottery Pre-K is starting on Monday, and Lottery Pre-K is a free program for anyone in Georgia, as long as the child is 4 years old by September 1st. So we had a few openings, but as of today, unfortunately, We are full, but we will gladly take a wait list.
So we need a wait list, which means that we need more openings and more spaces in Clarkson if you're almost full. So let's turn to David really quickly and talk a little, just very briefly about the child care safeguards that you put in place.
Yes, thank you so
Okay.
much.
Are you with us?
Hey, Roberta, thank you for having me. I'm really pleased to be able to share. Well, typically we know since COVID started, a lot of families were skeptical and they were in fear. So although some of our families chose to stay home while we were open, we've periodically conducted wellness checks on them by calling them and letting them know that we're here for them. And we were able to stay open because we were successfully able to adhere to all the recommended guidelines from the state and Center for Disease Control. So I know a lot of people are kind of have the gist of what those requirements are, but we made it a point at the center to reiterate with our teachers, all of our staff on a weekly basis as far as all of the updates. We also ensure that while we are open, we have a plan which would be considered a contingency plan. So which, should we have a case, what are we doing? So we made sure that every teacher in every classroom is doing their screenings throughout the day, and with the personal hygiene throughout the day, and the cleaning throughout the day. And we've also reduced our hours so that we can allow more of the deep cleaning being done daily. So we've had success doing that, and we're going to continue doing it. And we also have our plan in place should we have a case. So we should be in good shape.
Well, thank you. And knock on wood, you haven't had a case, so we hope that we continue that. Well, thank you both, Nadia and Alexandra and David, for sharing some ideas about how you and your families are coping with COVID-19. And we want to now open it up for questions from the audience and those that have joined us. And Ashley, you want to start with talking about the book and get feedback on the book and maybe some ideas about how we might disseminate it.
Yeah, that would be great. I mean, I think, you know, if anyone, any of the attendees had, as Roberta said, any feedback about the content, the questions and answers that were posed, and want to share that feedback, we would welcome that. So I'll pause in a minute and see if anyone has any feedback. And then just to reiterate your point, Roberta, what we're really thinking about now is how to disseminate it. So we do have some print versions. So they actually look like a flip book. So we have hard copy versions. We also have an electronic version that I can share with attendees from tonight. So we're also looking for feedback from folks about the best way to get these flip books out to the community. You know, so to certain organizations, how to reach people, say at apartment complexes, you know, where they live, where they work. So we're still in the process of brainstorming and welcome input about that as well. So I'll just pause for a few minutes and feel free to chime in. And then you could also put anything in the chat. Erica or Linda, I don't know if, I know you guys have been monitoring the chat, so feel free to chime in if there is anything you wanted to bring to our attention from the chat box.
Hey, Ashley, this is Erica. There were two questions asked early during the first panelist, Dr. Bowden. One was a clarifying question, and it was from Kathy, and it asked, did she say that there is a low rate of COVID-19 transfer among children under the age of 10?
Yes, Dr. Bowden, did you want to answer that? I'm happy to address it as well. I'll let you take a stab at that.
Took me a minute to unmute there. The difficulty, the reason that you probably got confused is because the research is a little bit confusing. The early reports did not find strong evidence that the children were young children under age 5 were major contributors to spread of COVID-19. But some recent research has shown a high amount of the virus found in children under age 5 in their nose. So it might be that they are more important contributors to the spread of COVID-19 than previously thought. So basically, once again, this gives evidence to the fact that this is a new virus and we don't know everything, and we continue to learn things and new research continues to be done. The hard thing in the beginning was the schools were closed, and so they couldn't do a lot of research. And so now a lot of the schools are still closed, but more research is being done, and research from other countries too. So it's really, and Ashley, if you want to speak to it as well, but it's been just a little bit controversial and hard to really nail down an answer to that.
Yeah, I mean, the research that I have read, I think, you know, this is a research question that's difficult to measure for a variety of reasons that I won't go into. So that limits the data that we have. The recent CDC report does suggest that children are less likely to have severe illness. So their hospitalization rate is lower and their death rate is lower. The study that Dr. Bowden mentioned about what we call the viral load in the nose and the nostrils, that's an important piece of information, but also doesn't tell us about their rate of transmission to other children and to other adults. All we know is that they have the virus and that the viral load is the same as an adult. But I've seen some scientists suggest that they may be less likely to transmit, in part because, for example, when children exhale or sneeze, it's not as powerful as an adult, just because their bodies are little. And so, you know, we're, again, to Dr. Bowden's point, there's the evidence is, I wouldn't say contradictory. There's just, we're just still learning, you know, but in my sense, collectively looking at all of the data that we have thus far, it does seem that children under 5 seem to be less likely to to contract COVID, and maybe less likely to transmit COVID, and are certainly less likely to be hospitalized and die from COVID. So those data are reassuring.
Great, thank you for that explanation. I have 3 more questions for you all. The next is, the recent death of a child in Georgia was attributed to a febrile seizure. The febrile seizure risk is higher with viral infections. Can you speak about appropriate antipyretic drugs for children and advice for parents and providers to avoid acetaminophen toxicity? Sorry, that was a long question.
So we do recommend using acetaminophen for children when they have a fever. If they take it in appropriate doses every 4 hours, they should not be getting toxicity from it. It's very unfortunate about the child who died. I don't know all the details. It sounds like maybe they're still gathering details, but yeah, it is okay to give the acetaminophen to children when they have a fever. So I don't know if that answers the question.
Okay, thank you so much for that response. The next question was, within a preschool, how many students should be within a pre-K classroom, and it still be a safe environment? So this is looking at how many students should be in a classroom for it to be safe.
So Alex or David, do you want to?
Yes, I can take this one. So we just had a webinar with the commissioner and with the governor about providers. Currently, the ratio for pre-K remains the same. However, they had some training with the teachers, and I was part of that training. They do not want large groups, so they want the teachers and the assistant teachers to break down the group into cohorts, smaller groups, and remain with those groups just to prevent any transmission, or in case they have a case of COVID and they have to isolate those children, we can trace back.
So how many children in a cohort? Or how many children does one?
They recommend between 5 to 10 children per one teacher, and that they move throughout the room. Thankfully, well, our room is pretty big for the pre-K room. So I'm not sure how other providers are doing it, the ones that are doing in person for pre-K.
So you're separating them into 2 cohorts in a big room. So about 5 children.
They are recommending that's what we do. That we this is the new guidelines for us for Lattery pre-K guidelines. Is the only room that I have that's a pretty big room. My other rooms are small, but for other providers, I'm not quite sure what they are doing. However, we are following early learning right from the start guideline and the CDC guideline and the training that we had. They want all the classroom Lattery pre-K to have cohorts moving forward. So for instance, phonological awareness group, large group, story time group, the children typically sit together. This time around this year, due to COVID, we will split the group, and my teachers had to do additional training because it was kind of hard to for them to implement that concept. They are so used to doing large group, morning circle time, and the children, that's gonna be hard for them. But we kind of maneuver, and we came to a consensus. So you have to be flexible and make sure that your groups, you stay with the group throughout the year. That's what they're recommending.
Thank you for that explanation. We have one more question in the chat, and it is, since children are normally required to have updated immunization records, how do you feel about requesting mandatory testing before returning to school?
Yes, the guidelines that we had received from last week, again, the guidelines change all the time. If a child gets tested positive for COVID, they need to remain isolated home for 14 days. Upon returning, it was required that they do have a negative test. As of right now, if they previously had a positive test and they isolate home for 14 days, upon returning, as long as they have no symptoms, no fever, they are able to return to school after the 14 days. But it's up to the provider if they want to require additional guidelines. For instance, we have a pretty strict guideline at the school. Even their shoes require 2 pairs of shoes. 1 pair of shoes for indoors, 1 pair of shoes for outdoors, and nobody's allowed in the building. It's really up to the providers if they want to implement the basic of what was handed to them, or if they want to step it up a notch.
Yeah, I mean, I wonder if maybe Dr. Bowden, you want to weigh in on this, and or Dr. Reines, if you're still on. I mean, in terms of requiring a test for healthy asymptomatic kids before returning to school, as opposed to what you just addressed, Alexandra, about someone who is positive and returning. It seems to me that that is not necessarily an effective strategy. I'm just thinking about the recent case with the summer camp in North Georgia, and all those kids were required to have a negative COVID test before they were allowed to go to the camp. But they required the test to be within 2 weeks of attending the camp. So clearly you can get a negative test, and then at some point in the next week or two, you're exposed, and then you go to school or to camp. It doesn't seem to me that a negative test and then a 1 or 2 week delay is important or effective information if people are not quarantining in that time, which clearly was not occurring with the summer camp. So I don't know, that's something for one of our pediatricians to weigh in on, but it seems to me that testing healthy kids before return to school, especially if there is any delay between that positive or that negative test and school or camp re-entry, that is not that useful of information.
I agree with that it does not seem helpful to get just overriding testing for every child going to a school to be negative. That does not seem to be effective.
I'm wondering if there are any of our participants who have either, not necessarily a question, but a comment or a resource. I see Angela Moore up there who operates among her other tasks, an early learning program. If anybody would like to weigh in and share a resource or something you're doing, this would be a great time to share, or a comment.
Hi, Roberta. Thank you for acknowledging my presence, and I want to thank you for this webinar. It's been quite helpful, a wonderful resource for all of us in childcare. I do represent the Clarkston First Baptist Academy, and we, as Alexander was saying, we have been able to maintain. We've been able to stay open throughout the entire pandemic, and I think that's mainly because we've been very strict with our guidelines, following CDC guidelines, doing the extra cleaning, doing the temperature checks upon arrival for everyone, only allowing parents, preferably one parent, only into the center. We're doing the shoe thing as well, no 2 pair of shoes here, and just extra cleaning, extra sanitation, extra hygiene, and that's really kept us really safe. I think that's the key thing. I do want to reflect my thoughts on that last question. When it comes to, we have not had any positive cases. Yay! No parents, no teachers, no children, no nothing. We did have one parent who did get tested because she kept running a 99-degree temperature for 2 days in a row. And when we have any temperature, we don't wait to 99.5. CDC says 99.5, don't let the parent in. We stop at 99, and we don't allow the child or the parent into the center until they've gotten some clear explanation as to what's causing that parent temperature, because the child's home with the parent. So we've been very cautious, very careful, and we've gotten great results. So children are slowly starting to return, very slowly starting to return. And we're just going to maintain our strict guidelines, but we're not requiring any testing of anyone. We make a suggestion, as we did with that particular parent who had no explanation for a 99-degree temperature for 2 consecutive days, but it's up to them. But we're not keeping anyone out. We're not requiring any testing unless there's a fever and some symptoms, but we've not had anything other than that one parent who had a 99-degree temperature, and she was negative.
But do you have any openings?
We do have openings, and I'm looking for some new child care teachers as well. We've had a big influx of a big fluctuation in our staff. We've had some staff to move, and some who decided they no longer want to be in child care because of the fear. And so I do have openings for all ages. That's from newborns up to age 5. And I'm also looking for some great part-time and full-time workers too.
Angela, I'm wondering, this is Ashli Owen-Smith, and I see that there are also some other Child Care Center staff and directors from this GSU Child Development Center on the call as well. And I'm wondering if any of you guys want to weigh in on this. I'm just wondering about your experiences having stayed open this whole time, and Alexandra, you and David too, kind of what your experiences have been with the staff and how you have helped the staff kind of negotiate their stress and anxiety and kind of taking care of their own mental health through this. I know a lot of childcare providers rightfully feel nervous.
Yes.
And so I just wonder if anybody would like to comment on how you helped your staff get through this.
Yeah, I'll go ahead. I'll respond to that first. You don't mind, since I just finished talking. The first thing we did was to have a session. We kept our staff updated on all the latest information that we received from CDC and from DECAL. We made sure they were well informed. We provided resources, information to them. We made sure that they knew that they could ask any questions, they could share any fears or any concerns. If anyone felt uncomfortable or unsafe, we gave them the opportunity to not work for a while. We even changed our staff working hours. We switched to 6-hour days and divided the staff into half in the morning and half in the afternoon. And that really worked well because it gave the staff some free time to be home and to just kind of relax a little bit. We did notice some tension when students started to return. There was some tension. Staff even expressed the concern that, well, I'm okay because I've got these same children who've been here this entire time, but I'm a little uncomfortable as new people come in. And so we made sure that they gave extra time off. We are a Christian school. We actually prayed together for those who needed. So we became even more sensitive to listening to what their general conversations were, just to see what they were concerned about in case they didn't share it with us. Again, we allowed them, if they felt they needed to take some time off, we allowed that. We actually paid them a little bit more where we could to give them hazard pay, those kinds of things. And I think that has helped the morale of our staff a lot.
Thank you.
You're welcome.
I don't know if you guys will give me a minute just to ask a question, even though I'm a panelist, but I work with parents with a lot of questions. Some of them are asking for the early learning, especially the Giselle Academy. We have a lot of parents that goes to your program, and they were kind of asking a question like, how are you doing your open house for the new student? That was first question. And the second question is, if you find out that a lot of people they're not symptomatic, they may walk around with COVID-19 without knowing it. So for you to keep everybody safe within the building, what are your measures you're taking for the parents not to get in?
Let me talk about the open house. Okay, I'll take the question about the open house, and David will take the question about the safety guidelines. For the open house, we're going to have a drive-through contactless open house, just like we had a lottery pre-K graduation drive-through contactless as well. We wanted to give the students some closure in May. It worked really well. So we decided if we have new parents coming in the building, it's so nerve-wracking. To leave your child in the building, you cannot enter the building. You cannot see the room. You cannot see the teachers. So we decided to have a we have a roundabout. They're going to do a roundabout open house tomorrow, actually. And the teachers typically we're outside with our mask and our gloves, and we will put the package that we're supposed to give them for orientation in the package inside their cars. And they can see the teachers and wave, and the kids can also come and wave as well. But they get to see the teachers or put the window down and say hi. I'm Mrs. Lullaby. I'm gonna be a child's teacher this year at 6 feet distance. And we also one of my staff came up with an idea. They cannot see this, although they're gonna have the schedule. They're gonna have all the documentation, the newsletter, and things of that nature. We are going to do a Zoom for them. I think it's through WebEx or something else. So they can kind of like a virtual tool. We had virtual tool before, but this time it's going to be a virtual tool just to digest the Lottery Pre-K goals that we're going to meet with those children, and what are the guidelines parents need to follow, and what are the rules and regulations. And I'm pretty sure it's gonna work well. And while I'm in this topic, I wanna thank Roberta. We're going to also have a contactless drive-through back to school backpack giveaway tomorrow as well. We had a food giveaway with Cocomat. It went the same way. We had a pizza giveaway for like 2 months. It went well. We also had a census early literacy packet giveaway, same manner, and it went well.
Before David answered the second question, you know, as I said before, I work with refugee families who are also literate in their own language and cannot use technology very well. What form of communication or what form of open house are you doing for those parents? Because for sure that they're not able to communicate, also making contact with schools. I know they do registration. Some of them we are the one who do registration for them. So how are you keeping contact with parents that are not able to use technology?
Okay, this is the reason why we had the choice of doing 3 settings: hybrid, full distance, or just traditional. We decided as an organization to do traditional because of our community. We want to support the community. We're there for a reason, not for a season. And those children, they need the social emotional development. And because we have so many barriers, and we know language is the biggest one in our community. We have translators. And as a matter of fact, all my new families, we have spoken to all of them already.
So
But
we're
if
going to
you
have
are
to wrap up. And I think that we can have some of this offline. So Ashley, you want to close us out?
Sure, yeah, Linda, I know she was gonna put up the last couple slides. We just wanted to, let's see, that's the link for the decal guidelines for childcare settings. And then Linda, the next slide, Roberta and I just wanted to, the next one after that, thank our panelists, of course, and also to thank our sponsors, the Prevention Research Center at Georgia State and the City of Clarkston, and the School of Public Health, and CDF Action, and a special thanks to Erica and Linda for all of their administrative and technological assistance. And Linda, on the next slide, I just want to share with everyone, just for more information, we have both Roberta and I have our websites there. The Prevention Research Center, we have a page dedicated to resources related to COVID-19, and Roberta has provided CDF Action's email address for more information. So please do feel free to reach out to us. We hope we can continue this conversation offline. And so please do reach out if you need to or would like to have more information. And just a special thanks to all of our panelists for tonight for helping to enhance this conversation and for really making this possible. We really appreciate it. So thank you all.
Sorry we had to cut you off, but we, if you'd like to talk further, please call us. Thanks again to everybody.
Thank you.
Thank you so much for having us.
Thank you for giving us the opportunity to attend today.
Thank you,
Thank you.
everyone.